So if you have questions, we have microphones on both sides of the room. I'd like to start with allowing our speakers to reflect on what the other speakers said. If there was any sort of feedback people had and wanted to comment, I'll give free rein. Jason, you want to go first?
Yeah, in my talk, I started by focusing on the complexity of human health and that health outcomes are really driven by the interactions. And I think that was mirrored in the other talks. And I thought both of you really nicely articulated the importance of looking at interactions among factors. And, the culture is to take a very univariate, one factor at a time approach to these problems, and there are a lot of good reasons for doing that because it's easy and we understand it and it's easy to interpret, but that's just not how biology works. I was really happy to see the other speakers focus on that.
Yeah, so just building on that whole theme is human biology and the exposure science and environmental health is very complex, and that's where I think the artificial intelligence tools can really be brought to bear. I also was struck by both other speakers talking about that. What did you refer to, the death cycle? You talked about the hype cycle,
trough of disillusionment,
the AI winter.
The AI winter. So I think we also have to be very, very careful about what we promise, and that we have to be realistic about what we're promising, and what we promise has to correlate well with what it is that we need.
No, I think that, this is, to me, the main thing is that these are complex problems, and complex systems require a lot of careful deliberation, and it is not the task. If you think about my weighted definition of statistics, computer science, and domain experts, that automatically points to a team. And so some people are careful thinkers, and some people are good at implementation and visualization, and some people are bringing up, like, what you did is nonsense because this is how the data were collected. And so that's really the part of the team, and that has been a very valuable educational experience for me as a statistician.
So yesterday I was at the American Society of Mass Spectrometry meeting, and we were talking about the exposome and a lot of untargeted analysis. And in thinking about, we've already talked about a lot of complicated data, but for example, in the PROTECT, you're talking about targeted measures of 50 or 60 items, and now we have this ability to measure hundreds of thousands of features, and talking about the need to reduce some of those data, and also thinking about satellite data and other sort of monitoring stations. Is I think that we've just kind of touched on some of the easier streams of data that we have in environmental health. And I want to get your comment about some of these more complicated pieces, like how do we fit these complicated things into our models of these exposures and risk scores? Anybody?
So I think that, this is an untargeted analysis. So as I said, exposome, the word was used in 2005, and so it is not even 15 years of this large-scale exposure data. It will take us some time to figure out what is the actual methods, but I think we are all working together and incorporating the domain science in terms of understanding this untargeted analysis, and particularly, I think, the correlation and the sources, how that information about source information, the biological information, and the grouping correlation, the statistical correlation grouping information can all be tied together. I see some of the Bayesian methods coming here as a natural progression of those ideas in an analytical platform, and very promising.
Okay, great. A comment that I would make on this is that I think we have to have a framework in mind and how we're going to use the data before we start collecting the data. And because, take mass spectrometry and let's take metabolomics as just as a discipline, an omics discipline. How do we collect that data in such a way that we know that if we created databases of that we're going to be able to cross-reference that to transcriptomic data sets and genomic data sets? Simply the fact that you can collect it all doesn't mean that it's going to be a data set that's going to logically contribute ultimately to helping understand how the exposome actually works. So I think that, I pick on metabolomics because there are a lot of different technologies that are out there. I mean, some of them are exquisitely sensitive and will tell you all the different things that are present within your sample, but won't give you a clue as to what their level is. And there are other technologies at the other extreme will take a few of those compounds or metabolites and will tell you very accurately what their concentration is in a particular sample, but there may be a lot of things that are missing. So thinking, developing a framework for how you're going to use the data, have that framework in mind before you start collecting it. And then, people who collect the data may be agnostic to what technology they use to collect it. So if there's a framework on how you're going to use it, it may help to inform how they're going to collect it.
Okay. So let's go to the questions, people at the microphone. Again, please introduce yourself.
So I'm Patrick McMullen from Citivation. I wanted to, Bhramar, you introduced this, I'm not sure where we landed, if it's competition or not, between the kind of the algorithmic and the stochastic modeling. You hinted that kind of the difference in how we're thinking about those models, where the stochastic is maybe more focused on the theta, whereas the kind of the algorithmic more focused on the y, the observation. You hinted that is cultural as much as anything else, right? That maybe I'm reading between the lines a little bit, but it's not necessarily true that it has to be like that. It's just how we're using them, and I'm wondering what that tells us. And if Jason and Rick, you have thoughts on this about kind of how the way we're using modeling in science is evolving. That is it that we're embracing more complex problems now, and that's why we're kind of turning in that direction, or what?
I think I would like to sort of say that I was just trying to allude to two schools of thoughts in terms of modeling cultures, and it definitely depends on the problem at hand. And all I was trying to say is that most of these tools are geared towards prediction, and you can cast many inferential problems into the tools of prediction as well. The two things I wanted to sort of, we definitely need complex models. We definitely need to go beyond linearity, and we need to think about nonlinearity, variable selection, dimension reduction, interactions, and these are not simple systems anymore. But I do think that there is a marriage there is a sweet balance between the two approaches, that you are building the complex models, but also studying their mathematical properties of random partitions and trees, also trying to make some effort to characterize the uncertainty in them, also trying to think about where your data comes from. So I think it's sort of the nice union between the two cultures. What you use for your F hat is least important to me, because you will use the best tool that we are all, and that's why I think we need to equip our next generation of statistics and biostatistics students also in being comfortable with these sets of models and tools. But also don't give up the mathematical rigor and the sampling and the experimental design and the thinking about missing data and thinking about causality and all of these tools. I think computational and learning tools are very useful, but they have to be sort of not thought about. I think there is a sort of a difference in the two cultures as well. One culture is sort of, I can do it, and the other one is too careful, even when they can do a pretty good job. Somehow the perfect becomes the enemy of the good. I just think a doer and the thinker, that combination is going to really advance science. So that's all I wanted to mention. Thank you for the question.
Yeah, I think it does entirely depend on the problem, and this whether you use inferential methods or whether you're doing prediction. And just as an example of that, if you're a dermatologist and you're trying to diagnose melanoma from an image of skin, you might not care so much about what the algorithm's doing or what it's keying on. If it's doing a better job of predicting who has melanoma than a clinician, then that's a good thing, right? But if you're say a toxicologist and you're really trying to understand the mechanism by which a toxic metal impacts a biological molecule, then inference becomes very important and causality becomes very important, because you don't want to spend $1 million designing a bunch of experiments to study something that's false, right? That's not real, that is an artifact of a machine learning algorithm. So I think whether you go down the inferential or the prediction path, I think very much depends on the problem you're trying to solve. And I would argue that these are not mutually exclusive things. And I've never been a proponent of taking one or the other. I think the right approach is to do both. I think using inferential methods, using machine learning methods, using them both on the same problems will inform you more than either one alone will. And I think they're very complementary and tell you different things. And the truth is, the reason you do machine learning is because you're trying to figure out what you missed by using the more strict inferential methods that have a lot of assumptions. So you do both, and you're going to learn something from both that you won't from doing either one individually.
I mean, I don't have a lot more to add on this, but I just want to make a comment around embracing complexity. Human biology is really complex, and actually the good news is that we finally have tools where we can do whole genome analysis, we can do whole transcriptome analysis, we can look at the whole battery of metabolites. So we can really develop a whole parts list. But I think the other thing we have to be careful about, and I'll pick on transcriptome as an example, we now have RNA-seq, which is enormously better than microarrays, both for sensitivity. Microarrays simply tell you what you already know about parts of a gene that you put on the chip. RNA-seq, and actually it was Sidney Brenner who really developed and pioneered these technologies. He wanted a technology where the cell can tell you everything that's happening within the cell. And that's what we have now with RNA-seq. So in the analysis of transcriptome data sets from RNA-seq, we've actually embraced complexity, kind of. Okay, so we actually look at, in many instances, we look at expression of the open reading frames associated with the messenger RNAs that are captured on RNA-seq. But for the most part, we're ignoring a lot of the differential splicing, differential polyadenylation, different promoters. And we know that that drives a lot of complex biology. So we've taken a step in the direction of embracing complexity. But I think what we ultimately want to do with artificial intelligence is develop tools that can actually address all of the complexity inherent in a sample that we're analyzing, and not just parts of it.
Okay, John.
Hi. Hello. Hi, I'm John Wamba from the US EPA. I wanted to follow up on the topic that was being discussed. I really liked the shrinkage equation for the competition between the two cultures. But I think that matches pretty well with what Professor Moore was saying about approaches to AI and how right now it's too hard to do a top-down approach. And, how does the brain work? Well, we don't know. So it feels to me not so much like you need both at the same time. Right now, empiricism is ascendant because the problem is so complicated. And I'm on that bandwagon. I've been pushing the pendulum toward empiricism for a while. How do we know when we know enough, when we have enough empirical models to start going back and saying, you know what, maybe we should build a top-down model of the brain for intelligence? And I feel like science goes through those swings of, right now we're collecting all this data, we're looking for all these patterns. How will we know when it's time to get off the empiricism train and start to go back and really mechanistically understand things?
No one wants to answer that.
I'll pick on Professor Moore first, as he had the top down.
I think it's a great question. I mean, I don't have an answer to it. I think the empiricism wave that we're on now is going to go on for a long time. As Rick said, we still have a lot to measure. We have a lot of different parts of the complex biological system that we need to put together that we haven't done yet. And that's going to take a long time, probably decades, right? And so I think we're going to be swimming in this empiricism ocean for a long time. And I think the top-down AI approach, I get asked this question a lot about, when do you think we will have true top-down AI? Think about robotics, and I don't see it in the next 50 years. Certainly not in my lifetime. I think that's probably 100 years out or more. So the top-down AI approach, I think, is very, very far in the distance.
So I think it's very hard for me to talk about AI, something I'm not an expert on in broadly, generally. But I think in the context of environmental health science, I think that, if you think about the success of GWAS or genetic association studies and when they started getting replicable results which are being translated into like polygenic risk scores and the drug targets and so on, is that large on good measurements and good measurements, cheap assays so that its large-scale measurements are possible, and collaboration across the whole world in terms of putting studies together and not holding the studies proprietarily and just really, really do meta-analysis of everything that is available in the world. Like if you look at some of the modern GWAS studies of height, BMI, lipids, they are of the more 500,000. UK Biobank, if you think about UK Biobank, it's 500,000 people with lots and lots of data. So I think we need large data sets where we have collected lots of measurements on lots of people and very good algorithms to learn. But from a statistical point of view, in terms of which method works well, that's what bothers me, that deep learning gives like this good prediction of diabetic retinopathy, but then does it which population, and would it generalize, and why does it work for this data set and why doesn't it? So I feel some of the mathematical underpinning and knowing that this is under what condition these methods are work will give me a lot of solace and peace, and also in terms of inference on this complex model, not just giving one prediction.
So I'll just build on that. I'm a big proponent of international cooperation. And actually being at the NIH, one of the things that we can do is provide the rewards for people to be collaborating together, which is not something that we've done very effectively in the past. So you get what you reward. It's that simple. So we'd like to be able to do that. But I'd like to return to a point that I made earlier, which is really about us creating a framework. So if you're going to have people working across the global environmental health sciences community collecting data, I think it would be really useful to actually identify, ultimately, what is it that we'd like to achieve, and what type of data sets do we think that we'd like to create, and to create some of these data sets, do we have to build new technologies? It's like with the exposome. I mean, there are certain things we'd like to collect. We don't know how we're going to collect it yet because the technologies haven't been developed. This is very similar to what we did with the Genome Project. Really set that goal. We need to develop some technologies, and then ultimately, this is what we'd like to have. And once we have that kind of ultimate framework, then we can actually back up and say, well, we're going to make progress on this tomorrow. And we have the ability to, and again, I'll pick on transcriptome, to analyze open rating frames, okay? So when we talk about the data that we have, always put in the qualifier that, and we're not looking at everything that's within the cell. So we're making predictions now based on looking at the expression of open rating frames. So there's more to biology, and then as there's the technology and more AI gets integrated into our approaches to analyzing the data and more complex data sets, we're going to know more about the system. And so ultimately, with the idea of really returning to that ultimate framework to understand how complex biological systems are actually working. Okay. Cool.
Thanks.
Hi, Nicole Kleinsteuer, NIEHS. So that was, I already had my question in mind before this conversation evolved, but this was a really, really wonderful lead-in to it, because I think in the spirit of embracing complexity and in even being able to examine complex interactions, what we really need are data sets that can be integrated with one another. And so there's even the possibility that we actually already have enough information collected to get towards answering John's question, but yet that information is in disparate data streams that are not being annotated using the same types of vocabularies and ontologies, and therefore can't be integrated in a really functional way to allow them to be properly analyzed, right? And so I wonder if the panelists could speak to not only the importance, but really more specifically about existing ongoing efforts to apply annotations and ontologies and controlled vocabularies to not only the collection of data, but the curation of legacy data, and where there are opportunities for artificial intelligence to help assist with that process.
Did be alphabetical. So
I agree with you completely, and I think this touches on what Rick was saying about, what are we going to collect, how are we going to collect it, what are we going to do with it, and I think keeping the data integration in mind as we collect data and thinking about it from an ontologic point of view, how are we going to describe these data, what standards are we going to use? And that's certainly happening in the electronic health record domain, but not so much on the more basic science level. Although there are some examples of some really nice projects attempting to do this. I'm thinking of Melissa Handel's Monarch project, which is an NIH-funded study at Oregon Health Science University, to build an ontology to integrate genetic omic findings from human and mouse, right? Because we use different terminologies in the mouse community and in the human community. And so if you're a clinician and you're looking at a mutation in a patient and you want to know, is that mutation actionable, you'd like to be able to not only tap into the human literature, but also the mouse literature, right? And her ontology makes it possible for you to move across model organisms and humans. So I think we have a huge amount of work to do in that space. We barely scratched the surface, but I agree it's absolutely critical for success. I do think AI and machine learning can play a role. There are plenty of examples of machine learning analysis of data to inform new ontologies and new data standards and descriptions.
yeah, so I from my background in working in genetics, I have often asked my environmental health science collaborators, what is a standard exposure panel? So they look at me like, I only care about PFAS. So I think that's important, right? If you are actually looking at what is critical to collect, that common data element, and even the same exposures, when they come from different studies, like Puerto Rico and Mexico and Boston has completely different types of measurements. And I think it's very important. Sometimes we forget that how important the variation in the range of exposure can help with power of studies, that if you are actually very concentrated region of exposure, you only sample a little part of the dose response curve, but really variation in the range of exposure and doing studies in multiple places can really add to that. And if you have studies in India, I have looked at that there is a whole realm of variation in physical activity. Some gene environment interactions with physical activity, which takes like 100,000 people in European studies, needs very much less in India because there's the realm of exposure variation over a wide spectrum. So these are the basic guiding principles in terms of multiple studies around the world. What is a common exposure panel? How can you actually put things together and encourage collaboration? Right now, all the large-scale studies we do still are unenhanced because that has a uniform set of variables on 5,000, 6,000, a decent number of people. So
Nicole, I'm really glad that you brought that point up, and it's critically important to have it as part of this workshop. Getting back to my whole concept, we should start with a framework of where we ultimately want to be. And if you have a framework of where you want to be, and you actually get people around the table talking about how do we collect data in such a way that we're all going to contribute to the common good, you're very quickly going to realize that unless you have standardized ontologies and vocabularies, you're going to run into big trouble. And I worry that if we don't kind of stop as soon and address this issue, we're going to continue to spend huge amounts of money collecting complex and important data sets, but data sets that are fundamentally not integratable and useful ultimately for AI applications. So I think we need to address this. And part of this is going to be changing the sociology of how we do biology. And again, it's providing rewards for people to work together. And now, if you want to do a big study, you actually work together with your immediate collaborators. You come up with, what are the tools we're going to use to collect data. And then you go ahead and collect data, and then you develop your own database. And there's this stuff that's out there, which may or may not integrate with the data that's being collected around a similar problem at a different university with a different group. So, just ontologies, common ontologies, and vocabularies. Especially, the Genome Project was complex in itself, but C's, T's, A's, and G's is simple. And on the one extreme, on the other extreme, you have electronic health records, and you have phenotypes. Is it hypertension or high blood pressure? Machines are actually pretty dumb. They don't know the difference. And so we've got to come in with the standardized ontologies and nomenclature and ontologies and vocabularies as soon as possible.
Woychik.
Hi, Woychik, Texas A&M. I want to return to something that Dr. Mukherjee mentioned in terms of characterizing uncertainty, because in terms of ultimately impacting environmental health decisions, decision makers, whether it's at a policy level or at an individual level, need to have some confidence in that, in the outputs of whatever algorithm or model. And that confidence is not just sort of a qualitative one, but also in terms of going beyond just a point estimate. What is the range of actual possible predictions given given the inputs? And then the other complexity is that, particularly for environmental health data, a lot of the inputs have very large either measurement error or representation error. For exposures, you're measuring at a specific point in time. For that, you have very sparse data over time. What is that representative of that individual exposure over a longer period, over their lifetime? And so all these input errors need somehow to be propagated. And I've only dabbled a little bit in machine learning with some QSAR work, but I don't see a lot of work in trying to incorporate sort of all the potential uncertainties and input errors and the output and the errors in your training set outputs into these algorithms to get a better sense of what is the ultimate sort of your prediction interval, essentially accounting for all these errors, potential errors.
So I very much resonate with your question and your point. And so if you think about my table, that what is my, there is one wish list that will have more improved measurements throughout lifespan, right? So that's something that is definitely going to improve the quality of inference and prediction. But also really in variable selection, in machine learning, in tree building, to advance the science of providing the uncertainty quantification. That I think that has started, and David has done some very nice work. The Bayesian paradigm is sort of a natural paradigm in order to quantify uncertainty on different parameters and complex models. But then it takes so long and it is so sophisticated, so we need to make some leap in terms of software translation and making that point. If we really feel strongly that this is important, why not make it accessible? Why not make it like a regular output that you can get from a software without getting to somebody's C++ codes on GitHub? So I think as a community, I think it's important to make that. We think that uncertainty quantification is important. And we are doing work which is sometimes really buried in obscure journals without any citation. Why not if we feel as a community this is important, get those methods implemented and out there? And maybe not the perfect method, but something works quite good and still scalable. I think that's where I think the subtle tension is that if you and mathematical studies can actually help you in make that computation faster, because you understand the structure of the partition and you start to understand the randomness in the space, and so you directly model that. And I think that's what the beauty of this whole thing is, that study it analytically and then approximate in order to get good uncertainty methods out there. And simplify the computation. I think we are working. I think the asymptotic theory and the theory on these things is emerging, and I think we have to just wait and make a push and focus on that. Yeah.
So with that, with the interest in time here, I think we need to cut it off here. I think we have a short 5-minute break now. Is correct? And let's go ahead and thank our speakers again, and we'll see you soon.